Welcome to our channel. Comparing private health insurance plans can be overwhelming with so many options. Follow these step-by-step instructions to evaluate plans effectively and choose the best coverage. Step 1. Gather all plan materials including summaries of benefits and coverage, provider networks, formularies, and cost breakdowns to compare options side by side. Step 2. Compare monthly premiums across plans. But remember that the lowest premium doesn't always mean the best value. Consider total annual costs including out-of-pocket expenses. Step 3. Review deductibles carefully as this is what you pay before insurance starts covering services. Lower deductibles mean higher premiums but less upfront cost when you need care. Step 4. Check copayments and coinsurance for common services like doctor visits, specialist appointments, urgent care, emergency room visits, and hospital stays. Step 5. Verify that your current doctors, specialists, and preferred hospitals are in each plan's network. Call provider offices directly to confirm they accept the specific plan. Step 6. Compare prescription drug coverage by checking each plan's formulary to ensure your medications are covered and noting which tier they fall into. Step 7. Review the out-of-pocket maximum, which caps your annual spending. Once reached, insurance pays own 100% of covered services for the remainder of the year. Step 8. Consider additional benefits like telehealth services, wellness programs, gym memberships, dental or vision coverage, and mental health services that may influence your decision. Don't forget to like this video and subscribe to our channel.